Good morning. It's so good to be here and to see so many of you from different parts of the world. And for us to be here as UNDP to share with you what we do, especially in the portfolio of HIV, health, and development. My name is Rosamary Kumwenda. I am the team leader for HIV, health, and development for the Eastern Europe and Central Asia Regional Office in Istanbul. I joined the team last year, and by August, I'll be 1 year old here in Istanbul. But before that, just for your information, because I saw the flag of Ethiopia, I worked in Addis Ababa at the Regional Center for Africa, UNDP office. And then before that, obviously in Malawi and in my country, Zambia. So I've been with UNDP for the past 17 years, and it's so good that we have a global organization. And Pelin, my colleague who spoke before me, talked about the number of countries that UNDP covers, which is really around 170 countries globally. And I'm sure most of you have got UNDP country offices where you come from. Technology. That one, okay. All right, so my presentation outline will be really looking at our geographical coverage. I'll also touch on our mandate as a UNDP HHD team, and briefly touch on the type of support we provide. Then I'll move on to give you an example or a flair of what we have done, especially in the area of HIV NGO social contracting. And then I'll end with some few examples on how we have had some MOUs with NGOs and probably NGOs as grantees of our program. In terms of our geographic coverage, in this region, UNDP has country offices in 19 countries and territories in the region, covering Western Balkans, Western CIS countries, and Central Asian republics. So really, we have a very vast coverage, and sometimes we do develop sub-regional projects and programs that cover the sub-regional groupings. But actually, for HIV, health, and development, we also have a UN-wide framework in which we work. And I think most of you understand when we talk about the UNAIDS framework. So within the UNAIDS framework, UNDP has a particular mandate, and within that particular mandate, it ensures that we have a division of labor so that we don't duplicate what we do as UN agencies. So with regard to UNDP, we have to align our work, obviously, with the SDG imperative for leaving no one behind. And really, these are programs that are linked to the rights of the marginalized and strengthening the governance of HIV response to meet the targets of the SDGs. So we also have some corporate guidance, which guides our work, obviously emanating from the SDG agenda. But within the SDG agenda, we focus mainly on SDG 1, 3, 5, 10, and 16, but also a little bit touching on SDG 12 on responsible consumption. So UNDP has a strategic plan which is ending this year in 2017, and we have embarked on developing a new strategic plan which will cover 2018 to 2022. We also have a UNDP strategy note on HIV health and development, which I'll elaborate a little bit more, but actually reiterating that our work is anchored on sustainable development goals. With regard to our HHD portfolio, which is HIV health and development, we have three main areas of focus. Our first area of focus is essentially to reduce inequalities and social exclusion that is driven by HIV, to ensure that we don't see poor health outcomes. The second focus area is promoting effective and inclusive governance for health, which really, for me, when I was reading about Green Crescent, I was very happy to see that our work on this outcome area synergizes a lot with the Green Crescent work on focusing on strengthening the governance to address non-communicable diseases. And result area 3 is promoting effective and inclusive building resilience and sustainable systems for health. But let me just sum up that when we projectize our response to HIV health and development in this area, we have 1, being HIV and the law, implementing the Global Commission recommendations on HIV and the law. So we're looking at human rights, especially for key populations who are excluded, remembering that within the SDG agenda, there is the imperative to leave no one behind. So those people that are being left behind because of probably due to punitive laws, this is the area of comparative advantage for UNDP. We also have a project that looks at the rights of LGBTI people and how they should also not be left behind. We also focus on social, economic, and environmental determinants of health, where our NCD, non-communicable diseases program is anchored, but also we focus on planetary health to ensure that the health sector does not harm the environment. So what is the type of support that we provide? UNDP's mandate mainly is to focus on providing policy and programmatic advisory support to government, but not government alone, but also to NGOs and other partners. So other partners might be private sector as well. We also work very, very strongly with the government and civil society to broker this relationship between governments and civil society on key issues that pertain to development. We also support programs that ensure that there's a multi-sectoral response or multi-sectoral approaches to issues of health and development. We know that health ministries, for example, cannot work alone on issues of non-communicable diseases. So that is where we foster multi-sectoral approaches. We also support knowledge management and innovation in health and HIV, but also support resource mobilization, and I'll highlight some of the examples of how we have done that within HIV and health and development. This region of Eastern Europe and Central Asia, most of the countries are either middle income or upper middle income countries, which means that donor support, if you compare with most of low income countries, donor support here is lower because countries are expected to use their own domestic resources to provide universal access to health. So seeing that as an issue, what has happened in this country, in these countries, is that most of the HIV programs especially were funded by donors and especially the Global Fund. So with the imperative of moving from low-income countries to middle-income countries, that qualification means that countries need to transition out of the Global Fund mechanism. So UNDP had to work with countries in this region. We supported them to create conducive legal, regulatory, and policy environment to make sure that NGOs are considered by national governments to get funding from the governments to support especially service delivery at community level. So we work with countries to implement some of the findings of the research that we undertook in the region to make sure that there is efficient and effective management of national programs. And we have recently been requested by some countries to provide procurement support. But we make sure that UNDP, when procuring services and goods and services for HIV and health, we have involved other stakeholders, including NGOs, to know what is being procured. What is the transparency mechanism that's being put in place? So we have examples in Ukraine where we have been given as UNDP $41 million to procure HIV, TB, and diagnostics and vaccines for the country. In Kazakhstan, 3.2 million for HIV and TB products. In Turkmenistan, 1.1 million for TB products and HIV test kits. In Uzbekistan, $3 million for the procurement of HIV and TB products. Now, this is important information because NGOs, you are the voice for the voiceless. And you would like to see transparency in how procurements are done. So if the governments have seen that UNDP can provide that support for ensuring anti-corruption in procurement mechanisms, it's very important that NGOs get involved in these mechanisms to see that there's access to services which is universally available to every citizen of the country. So we conduct a lot of research because everything that we do has to be evidence-based, and we've provided the evidence in a number of countries. And for me, I think an important example is ensuring that we could give 10 examples in 10 countries by conducting NGO social contracting assessment. What or how are the NGOs being involved by the governments to make sure that they participate? So we have produced 10 fact sheets on NGO social contracting in 10 countries in this region. An interesting example also is in Croatia, where we looked at the transition from Global Fund to domestic financing using national resources, where Croatia as a country put a mechanism for ensuring that government resources are actually given to NGOs to support the HIV response. With regard to human rights for key populations, I'll just be very, very brief here. Working again alongside the UN joint team, we conduct legal, regulatory, and policy environment to actually see how punitive laws and discrimination hampers the access to services for key populations. We provide capacity building to civil society, and we also provide access to justice for those that are being left behind. And in this case, we have a program in Ukraine where there is a conflict zone. That conflict zone requires our support to ensure that services are given to key populations that are secluded because of conflict, the conflict setting in that area. So the example we have in Ukraine is that we have a group of women. They are HIV positive, they are an NGO, and they are a guarantee that Pelin described. So they've received a micro grant from UNDP, our regional hub. We've granted them 20,000 for specific activities to ensure that positive people living with HIV in that conflict zone have access to services. It includes access to antiretroviral treatment. It includes even legal services. So there's a lot that the NGO does, and we are happy to support the NGO. Another example is with regard to non-communicable diseases, which for us is a growing area, working with WHO. WHO, as you know, are the lead agency working in the health sector. But like we said, health sector alone cannot manage cross-cutting issues that require multi-sectoral interventions. So for example, for you as Green Crescent, we are addressing a number of issues. You are addressing tobacco use. You are addressing harmful use of alcohol. You are addressing unhealthy diets. You are addressing physical inactivity. You are addressing addiction to technology, which I really liked. Yeah. Yes. So these issues require a lot more multi-sectoral approaches. So UNDP, in partnership with WHO, Framework Convention on the Control of Tobacco, we have, at the last World Health Assembly in June, we are happy to be partnering with WHO, and there is a grant that the Russian Federation has granted to UNDP and WHO, $1 million US. And so we are hoping that with this $1 million, you'll see, if you go and visit our website, there will be a lot more of those mechanisms being advertised for NGO participation in control of non-communicable diseases. So this is good news, because the Russian Federation fund that UNDP and WHO is investing in will have to last 15 months. So be on the lookout. Check out the programs on non-communicable diseases. Our focus will be on NCD governance, NCD coordination, municipality action, and SDG integration, so that we reduce these factors that we talked about: tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. So what I've put there, again, are some of the examples of the work we have done in order to ensure that what we provide is evidence-informed and evidence-based. Two more examples of our work with NGOs. We have another micro capital grant with an organization called ERA. ERA is a regional NGO that conducts research, especially for marginalized and key populations. They also conduct capacity building for legal and technical support to other NGOs. So we had a project in this region which covered Macedonia, Serbia, Macedonia, I should say that properly. Former Yugoslav Republic of Macedonia, Serbia, Albania, Bosnia, Herzegovina. And that project, actually, I hope you will be finding out, those of you who are from Albania, I see Albania is here. It's about looking at the evidence of how LGBTI people are either participating or not participating in programs. So ERA is an organization that helped us to do the research. And by conducting this research, we used a mechanism which was highlighted by Pelin, which is a micro capital grant. We provided $50,000 to ERA to conduct this research. And the research has provided the evidence for us to table jointly with the government on seeing how legislation, regulation can be changed or revised to ensure that people are not being left behind. And then the last example of an implementing partner that we have recently been working with is Healthcare Without Harm, is an international NGO. We have an MOU, and we sat together, developed a project proposal that was submitted to CEDA, and CEDA has agreed to allocate almost $7 million that Healthcare Without Harm and UNDP will be working jointly on. And Healthcare Without Harm is the implementing NGO for our project. So we are open for questions, Pelin and myself, and hopefully we have provided some insights on what we do in this region, particularly in HIV, health, and development. I thank you.